Why does cancer occur? Non-cause of cancer, interesting about science and medicine, prepared by the editors of website net by lesnian.ru. First reason, smoking. Smoking is responsible for 90% of all lung and bronchial cancers. These cancers kill about 2 million people every year in developed countries, half of whom do not even reach the age of 65. The risk of developing cancer of respiratory system is increased in people who are a lot among smokers. Second reason, nutrition. By eating too much calories, red meat and animal fats, it increases the risk of bowel cancer, but also tumors at the level of the prostate, uterus and breast. But fruit and vegetables have a protective effect, especially in the prevention of the cancer of the digestive system. Fifth reason, environment. Science 1775, a link has been identified between exposure to soot and the occurrence of a scrotal cancer in chimney sweeps, but other environmental carcinogens has been defined. Asbestos, aluminium, arsenic, ionizing radiation, hematite, skin dust, lindan, coal, beryllium, cadmium, mineral oils, neutron radiation, phosphorus 52, vinyl chloride, wood dust and others. Fourth reason, alcohol. Alcohol is an important risk factor for cancer of the esophagus, liver, throat and mouth. The combination with smoking only increases the risk. Several studies have found a link between the occurrence of breast cancer in women with alcohol consumption. Five reasons. Irradiation. The first case of a cancer resulting from irradiation was described in 1904. In 1944, it was noticed that doctors working with X-ray were 10 times more likely to die of leukemia than other doctors. The survivors of Hiroshima bombing in the 1945 confronted the first cases of leukemia in 1948. Typically, leukemia occurs after 80 years from irradiation, while other types of tumor after 20, 30 or 40 years from irradiation. Sixth reason, viruses. The first link between certain viruses and the onset of a cancer was seen in relation to the Epstein-Barr virus, which is the cause of infection mononucleosis. This virus causes African Burkitt's lymphoma. The hepatitis B virus can cause liver cancer. The carcinogenic role of retroviruses such as HIV is well understood. Cervical cancer is more common in women who have had papillomavirus infection. Reason 7. Solar radiation. The fashion of sunburn in recent decades has caused an increase in the number of patients with skin tumors, melanoma and carcinoma. The influence of the ultraviolet rays, especially UVB, have been proven in the occurrence of skin cancer, especially in people with fair skin. Reason 8. Heredity. Even though there are no genetically transmitted cancer-related predispositions have been seen for some types of tumors. Thus, for family members who have a relative with ovarian, breast and bowel cancer, the risk of developing the same type of cancer is 2-4 times higher than whether other people. Some genetic diseases are associated with an increased risk of oncological disease, which mainly affects some organs. For example, retinoblastoma in trisomy 21 or in Mongolism. Reason 9. Hormonal drugs. The occurrence of vaginal cancer in girls whose mothers took diethylstilbestrol in first 3 months of pregnancy gave rise to the assumption of a carcinogenic side of hormones. When estrogen are taken as a contraceptive associated with progestogens, the risk of breast cancer is not great. That's all. Thank you for your attention. This material was prepared based on the material of website netbylisden.ru. Attention, this material is for informational purposes only. When observing various unusual symptoms, it's recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.